An estimated 17.9 million people died from cardiovascular disease in 2019, representing 32% of all global deaths. Hello, welcome to Molecular Evolution Laboratory Limited (MEL), where we have your interest at heart. We speak from the heart. Are you, or anyone you know, suffering from heart failure? Need to monitor your heart failure while on medication? Get blood tests that can help diagnose and monitor disease that can affect the heart. Your doctor may order blood tests to check the levels of certain molecules, such as brain natriuretic peptide (BNP). These levels rise during heart failure. Other cardiac biomarkers such as troponin I or T, HSC reactive proteins, and creatine kinase are routinely measured in emergency rooms. These markers can indicate whether the heart is functioning properly. If you suffer from chest pain, shoulder pain, neck pain, shortness of breath, wheezing, racing of the heart, difficulty lying flat, or persistent blood-tinged cough, swelling of the feet, and you are known to have diabetes, hyperlipidemia, hypertension, or pre-existing heart condition, you might be suffering from a heart attack or heart failure. In this case, your best option is the nearest emergency room. If you have been diagnosed with heart failure and is medically stable, you can monitor your condition using a wide range of testing options at the Molecular Evolution Laboratory. Our mobile team will come to your location to collect your sample. Our team also visits nursing homes, hospitals, and clinics for samples, and this service is especially useful for elderly patients. Out of the 17 million premature deaths under the age of 70 due to non-communicable diseases in 2019, 38% were caused by cardiovascular diseases, or CVDs. Cardiovascular diseases are a group of disorders of the heart and blood vessels. They include coronary heart disease, a disease of the blood vessel supplying the heart muscle; cerebrovascular disease, a disease of the blood vessel supplying the brain; peripheral arterial disease, a disease of blood vessels supplying the arms and legs; rheumatic heart disease, damage to the heart muscle and heart valves from rheumatic fever caused by streptococcal bacteria; congenital heart disease, birth defects that affect the normal development and functioning of the heart caused by malformations of the heart structure from birth; and deep vein thrombosis and pulmonary embolism, blood clots in the leg veins which can dislodge and move to the heart and lungs. Cardiac biomarkers are substances that are released into the blood when the heart is damaged or stressed. Troponin I or T, the most commonly ordered and most specific of the cardiac markers. It is elevated positive within a few hours of heart damage and remains elevated for up to 2 weeks. Rising levels in a series of troponin tests performed over several hours can help diagnose a heart attack. Creatine kinase CK and CKMB has been largely replaced by troponin. It may sometimes be used to help detect a second heart attack that occurs shortly after the first. CKMB is one particular form of the enzyme creatine kinase that is found mostly in heart muscle. It rises when there is damage to the heart muscle cells and may be used in follow-up to an elevated CK and/or when the troponin test is not available. Other biomarker tests include HSCRP. This test may be used to help determine risk of future heart attacks in people who have already suffered one in the past. And BNP or NT-proBNP. This is usually used to recognize heart failure, but an increased level in people with ACS indicates an increased risk of recurrent events. Most cardiovascular diseases can be prevented by addressing behavioral and environmental risk factors such as tobacco use, unhealthy diet and obesity, physical inactivity, harmful use of alcohol, and air pollution. Ensure to consult your doctor, as you might need other important investigations such as electrocardiogram to look at your heart's electrical activity, an echocardiogram to measure how well your heart is working and look at the structure, and a chest x-ray to see if your heart is enlarged or there is fluid in your lungs. Other tests may include echo stress test, imaging such as a cardiac CT scan, cardiac MRI, or nuclear heart scan. Some patients may also need cardiac catheterization with coronary angiography to look inside the arteries to see if they are blocked. If you or someone you know needs monitoring for chronic diseases such as diabetes, hypertension, hyperlipidemia, cerebrovascular disease, heart failure, and is unable to leave home, make use of our mobile service at the Molecular Evolution Laboratory. We have our mobile team who will come to your home, office, hospitals, and even clinics to collect your sample. Your medical report is sent to you digitally, so there would be no need to leave home because we come to you to take care of you at the Molecular Evolution Laboratory.